Well, thank you, Stephen. Good evening. You know, the data have now definitively answered the open question about natural immunity, and the public health officials had the wrong hypothesis. They were not even close. The natural immunity was 3 times more protective against hospitalization. Now, when you get something this wrong, you apologize. You've either lost your scientific objectivity or you apologize. Tens of thousands of careers were ruined. We have now a hospital staffing crisis throughout the United States in many rural hospitals. Ironically, many staff were fired because they had circulating antibodies, but they were just antibodies the government did not recognize. Ironically, when we had nurses fired with natural immunity, we fired those least likely to spread the infection. And now we've got hospitals calling in COVID-positive staff after they fired a batch of nurses saying, hey, it's that bad, we're in battlefield conditions, please come in and work. And look, public health officials just need to acknowledge they got this very wrong. Starbucks is now hiring back workers. Delta Airlines, GE, Boeing, Amtrak, they're recognizing now that the data on natural immunity is compelling. It was actually there all along.
Well, that's what I wanted to follow up with you on, which is why did we have to wait so long here? It's such a different outcome from what you saw in Europe, as I was just pointing out. You and others were calling for this, at least a year ago, all through last year. Why do you think it took the CDC so long? Was it just incompetence, bureaucratic bungling, or was it that it was ideologically they're opposed to this conclusion, so didn't want to hear it?
Now, Dr. Fauci or someone at that level handed down an edict that we have to vaccinate every American in order to get out of the pandemic. That was the message, and nobody was supposed to veer from that message. And so you had a very dishonest conversation and really, in my opinion, a blocking of all research on natural immunity. I talked to one investigator who submitted a study to the NIH. It got a top score. It was scored by an independent review committee, but oddly was never funded. And yet we see that researchers who changed their tune on the Wuhan lab leak received millions soon after they changed their tune. So the NIH controls the currency of academic medicine. And I think they really use that to say, look, we're just not going to study this question. My research team at Johns Hopkins did the study on natural immunity through private funding. We got philanthropists to fund the study. And of course, it shows that natural immunity is definitive and it's durable as long as it's been around to study.
Could you just very quickly, Marty, just expand on that last point, because it's important people understand. Finally, the CDC admit that the natural immunity is more powerful than the vaccination in preventing infection, but they still haven't published anything on how long it lasts. That's why you did your own study. What exactly did it show?
Yeah, so it's not that hard. You interview people who were infected nearly 2 years ago, and what we found is that they had detectable circulating antibodies, and the level of immunity was comparable up to nearly 2 years later as it was during the initial phase. And the CDC did acknowledge natural immunity is powerful, but they did it in the fine print. They did not in the messaging of their own study.
It's a real scandal, as I said, and thank goodness that you're there.